Sayre High School is located about 20 city blocks from the University of Pennsylvania in West Philadelphia. More than 85% of the students at Sayre come from families the school district of Philadelphia considers economically disadvantaged. In 1996, as part of its commitment to public education, Penn began a partnership with Sayre, creating one of the first university-assisted community schools in the United States.
Sayre and the notion of community schools were invented, if you would, almost by University of Penn and Harkavy.
The idea specifically of having Sayre be a focal point for university-assisted community schools as well as for a health center came out of a conversation with the then principal of the school, who had spoken to community leaders and indicated, we do want to develop a university-assisted community school. We are for that, but we would like very much a school-based community health center.
As part of this initiative, Penn's Netter Center for Community Partnerships joined with school and community partners to open the Sayre Health Center in 2003.
The Sayre Health Center is a federally qualified health center that treats all patients regardless of income or medical insurance status.
I can't think of a better way to deliver primary care and preventive care to not only students but their families than through school-based clinics.
Penn students from 11 of Penn's 12 schools collaborate with students and teachers at Sayre.
Here at the Health Center, I am an intern, and we go out for outreach to, tell the community about us and what we do, and give them information.
All the way down. Does that make sense?
I can't think of any other place where high school students, graduate students, we have post-bac students who have just finished college, come together in one unique setting where we all work together in a health setting, but also for the doctors, for the community in such a diverse way, and are really allowed to get hands-on with meeting people and working together, and it's been an awesome experience to work with everyone.
Today, Penn's involvement at Sayre continues to grow with programs including nutrition and gardening, career and college preparation, science education, and internships at professional work sites.
Making schools the center of community activities. Not just the place for kids to go for a few hours a day, but it should be the place where we can have health care, where we can have library access and recreational access and other youth-serving organizations being able to interact with our young people.
I want to be a nurse practitioner when I get older, so this for me is a good opportunity.
I really feel like my experiences here will really carry over into the future years at Penn Dental.
Penn's model of university-assisted community schools has not only grown and developed in Philadelphia, but it has been replicated across the United States. In 2009, Penn was named #1 as a good neighbor among colleges and universities for its model partnership programs that advance teaching, research, and learning at Penn, and simultaneously the quality of learning and the quality of life in the community.
I'm just growing up, and it's like I'm just in a healthy environment. So.